What a beautiful day to suntan. Hey, I haven't seen that mole before.
Hey, get out of the sun. UV rays may give you vitamin D, but you can still get skin cancer. I would recommend going to Dr. Lee for that mole. Here's his business card.
I guess I'll go to Dr. Lee then.
Oh, yeah, hey. Sorry, I didn't see you there. I'm Dr. Lee. Have a seat. Alright. So, what seems to be the problem today? Ah, I see. You've got a rather large lesion right here. It looks a little waxy and a little crusty in the edges. Well, it appears to be a case of basal cell carcinoma, or BCC as we call it in the hospital. But let me ask you a few questions before we get worked up about it. Can I get this chart over here?
There we go, boss.
Thank you. Alright, says you're German here, which, well, Europeans do have a higher chance of getting this particular form of cancer, but I wouldn't be too worried about it right now. Let's see here. It says you're also 43 years old. Well, there's a higher risk for people above the age of 40 to 50, so we might have to keep an eye on that too. And it says, your family history. It says many of your ancestors have had skin cancer in the past. Is that true? It's troublesome. Alright. Well, do you perhaps, suntan a lot, or maybe you go to the tanning booth every... I don't condone such behavior, by the way, but I'm going to put this in your chart here. Alright. Well, right now it's looking a little serious, but don't worry. It's a very treatable form of cancer, and it's pretty common too. 2.8 million Americans get it every year approximately, and there's very few deaths among those people. I'd say maybe even 0. So we're gonna have to do a biopsy on it, and don't worry though, it's not gonna metastasize to any other parts of your body. So we'll contact you in 2 weeks, and then we should be able to move on to treatment options if it comes back positive, which it might. So have a nice day then.
Skin tissue of the patient.
I see. So it looks like the basal cells have moved into the dermis from the epidermis. Looks quite abnormal. There should only be one layer of basal cells, so it's quite odd. This one has an abundant multiplication. Omar, you want to look at this?
Yeah, sure.
Yeah, I can see how the basal cells have grown into the dermis and through the epidermis, and they've created a tumor, so that's very abnormal.
Guess really looks like a case of basal cell carcinoma.
Oh, hey, you should really stop sneaking up on me like that. It's good to see you again. Oh, stop, sit down. Well, as we said in our last visit, we had some suspicions that you had basal cell carcinoma, and so we did a biopsy, and your results just came in. Can I have his file, please?
Here you go, boss.
Thank you. Interesting. Well, it looks like our suspicions have been confirmed, but you do have a very small case of basal cell carcinoma. It's very, very treatable. It's a very standard case here. So we've got a lot of treatment options here at the Lee Dermatology Clinic. Our most recommended procedure is called the Mohs micrographic surgery. And what that is when you'll go into surgery, obviously, and we'll slice off one layer of skin at a time. And each time we slice off a layer of skin, we'll go under a microscope and search for each individual cancerous cell, and we'll keep going until we can detect no more. And this method really reduces the amount of healthy tissue excised, so it's really our most recommended, and it has a general cure rate around 98%. So there are some downsides, like it's much more expensive than our other procedures, and it's very time consuming, which I have no objection to, but just in case you have things to do, you know? But another great alternative is excision, which is where we'll just cut out the tumor in one big chunk, and this has a higher risk of cutting out lots of extra tissue that otherwise would have been healthy. However, it's very it's also a very successful procedure with success rates around 90%. But we highly do recommend Mohs micrographic surgery. And another one of our surgical procedures is curettage and electrodesiccation, which is also known as electrosurgery. So this is where we'll just kind of scrape it. This is for very shallow ones, and yours is kind of in between, so this one might not be the perfect fit for you. But this is where we scrape away the cancer cells, and then we use an electrical probe to burn away any extra cancerous cells that might remain. So then in our non-surgical procedures, we have, first of all, cryotherapy, which is where we'll freeze your cancer cells with liquid nitrogen, which will kill them. But it's usually used to treat cancers that are kind of shallow and very, very small. Yours is, again, in the middle, so this may not be the right choice. It's definitely not as effective as our other surgical options. And a thing to note is that this procedure will leave a scar. There's no way around it. Now, a new kind of experimental treatment is called photodynamic therapy. Now, this is where we'll apply a topical ointment to the tumor, and then the next day you'll come back, and then we'll apply a very strong light to these medicated areas, which will activate them. And then these will selectively destroy your cancer cells and cause minimal damage to the surrounding tissue. However, again, this is very experimental and it's kind of a new procedure, so our success rates are varying from 70 to 90%. And another thing to note is that you'll become very photosensitive for around 48 hours after the treatment, so and you'll have to stay under the sun, so that may not be very convenient for you. Now, luckily, you won't be needing radiation or chemotherapy. Radiation we generally use with elderly patients or like sickly patients that shouldn't be undergoing surgical procedures, and or if it's a hard to access tumor. And chemotherapy generally is only used for metastasized cancers, which basal cell carcinoma has a very, very low risk of. Now, our last treatment option are some topical medicines. There's a very new drug called imiquimod, and it's a new class of drug that works by stimulating your immune system to attack the basal cell carcinoma. And so far we've seen a very high success rate of about 80 to 90%. And for this you would have a treatment for around 6 weeks, and you would apply this ointment for around 5 times a week. Now, another similar drug is fluorouracil, which it is also a 6-week treatment, and it'll be applied to the area for twice a day. But again, I highly recommend Mohs micrographic surgery. We're the best micrographic surgery clinic around, and you'll have to go at least 100 miles in any direction to get the treatment we have here at Lee Dermatology. So I guess you can schedule your treatment at the front desk, and I will see you in a few weeks. Thank you. Congratulations on the stop. You're now free of basal cell carcinoma.
Thank you, doctor. What a beautiful day to suntan.
Oh, that's my turn.
What a beautiful day to suntan. Hey, I haven't seen that mole before.
Hey, get out of the sun. The UV rays may give you vitamin D, but they can also give you skin cancer. I would recommend going to Dr. Lee for help.
You didn't say something that's gonna can I have the patient sample?
Yeah, sure.
Tissue?
No, that's not good.
Recording in 3, 2, 1.
Could I please have the patient sample?
Yeah, sure.
I'm trying to waste time. So